Good morning, everyone. Thanks so much for joining us today. We're going to get started in a couple of minutes. We'll just give the audience a few more minutes to trickle in before we get started this morning or this afternoon. Thanks again, everyone, for joining us. We're going to get started very shortly. Okay, welcome everyone. My name is Helen and I am a Research and Outreach Coordinator for the FIU Jorge M. Metropolitan Center. Before I begin, I'm going to briefly introduce today's webinar, Solutions to Escalating Housing Challenges During COVID-19. Today's session is being brought in partnership with Centro Campesino and UnidosUS. This webinar is being displayed through Zoom's webinar mode, so panelists will be the only participants featured on the screen. All attendees will be muted for the duration of the webinar, and our panelists will be answering questions from the audience at the end of the session. So if you wish to ask questions, please type them into the Q&A feature on your Zoom webinar window. We will try to get to as many as possible before the end of today's session. Before I turn over the mic, I will introduce our moderator, Mercedes Marquez. Mercedes is an experienced practitioner, strategist, and innovator with more than 30 years of leadership and public service in housing and economic development, community advocacy, city management, and executive coaching. She's adept at both crafting a vision and executing it to create effective social change, and has served from multiple perspectives throughout these sectors: in local government as a deputy mayor in Los Angeles, and federal government as an assistant secretary at the U.S. Department of Housing and Urban Development under President Obama, as a civil rights advocate, and in real estate development. At times, she has overseen more than 800 employees and managed more than $50 billion in funds. Mercedes, you have the floor.
Good morning, buenas tardes, good afternoon, depending on where you are. We're so happy to be here with you today. This is an incredible collaboration between Centro Campesino, FIU, the Jorge Pérez Metropolitan Center, and UnidosUS. Today, we're here to speak with three experts, academics, researchers, and practitioners about solutions facing us in terms of COVID and all of the economic issues we face on affordable housing. So I'm going to be happy to be with you today. We're going to coordinate. We have an hour and a half set aside for this. You know, usually people on these webinars, you know, now that we're all hour to hour, start to drop off after an hour. But I want you to know, if you want to stay and chat after that time, we will still be here taking questions and happy to have a really great dialogue. Today, I want to introduce, first I'm going to start introducing you to who the three speakers are going to be, and then we'll move from one to the other. Helen is going to help me queue up the questions so that we make sure we're responsive and helping kind of move us all through this. So our first speaker today is going to be Agatha So. Agatha is a senior policy analyst with UnidosUS. She is responsible for shaping and implementing their housing policy and does so working across different teams: economic development, legislation, and housing and empowerment programs. So Agatha will be talking about a study, a brief that Unidos has completed on how Latinos are faring in COVID. Then John Martinez is going to speak. He is the executive director of Centro Campesino. He has over 25 years experience in all things housing and community development. He's worked in all kinds of different perspectives in housing. Importantly, he's taken on lots of different leadership roles. He is currently the chairman of the board of MAFO, a national partnership working on farm work organizations in rural communities. He's a member of the JP Morgan Chase South Florida Community Development Advisory Group, a member of the Trust Bank Florida Advisory Group, the Hurricane Irma Long-Term Recovery Groups in Miami-Dade, and he's also a former member of the Affiliate Council of Unidos himself, and a senior fellow in Mexico with the US-Mexico Solidarity Foundation. So a guy with tons of experience at all levels. And finally, we're going to hear from Dr. Ned Murray. He is Associate Director at FIU of the Jorge M. Pérez Metropolitan Center. He's a leading expert on economic development policy, planning, and real estate market analytics. He has served as a principal investigator on many landmark planning and economic studies for cities and county in South Florida, including this latest study for Centro Campesino. He's a highly respected former city planning and development director and has tons of hands-on experience, including 12 years as the former director of planning and development in Massachusetts. You will hear from him. He's done great work in Miami. Apart from that, he's just a really, really nice guy. So I'd like to start introducing you to Agatha So, who's going to walk us through a presentation on a brief that Unidos has just completed. Agatha, when you're ready, thank you so much for being here.
Thank you, Mercedes. It's really good to be here with all of you this afternoon on the East Coast, morning on the West Coast. I will start off with providing a bit of the context for our work, move into an overview of our issue brief on Latino renters in the COVID-19 pandemic, and conclude with some of the recommendations that we have laid out. Let me begin with a national context. In June of this year, the Aspen Institute estimated that by the fall of 2020, 1 in 5 US renters would be at risk of eviction. This risk was greater for households of color. According to US Census Household Pulse Survey data, nearly 1 in 3 Black and Latino renters had missed a monthly rental payment in the last 12 weeks between April 23rd and June 21st. Later, in the last 2 weeks of August, half of US adults reported they may be evicted from their homes in the coming months, and this danger was stronger for Latino and Black renters. Given this context, UnidosUS wanted to examine the effects of structural barriers for Latinos, including disparities in rent burdens and housing affordability. Let me see if I can navigate. There we go. Let's start with a few of the indicators. Even before the pandemic, Latinos were experiencing growing housing insecurity. In 2017, according to HUD's own research, Hispanic renters accounted for almost 25%, 1/4 of overall most worst-case housing needs, which means they had severe rent burden, spending more than half of their income on housing, and had severely inadequate housing. But nearly half of very low-income renters with the worst-case housing needs were Hispanic. In February 2020, just 1 month before the COVID-19 pandemic outbreak in the United States, 1/3 of Latino renters reported they spent over 40% of monthly income on rent and utilities. And as you know, the federal standard currently is that a household and a family should not be spending more than 30% of their income on rent or any housing expenses in order to maintain affordable housing. Adding to the housing burden was slow growth in median wages that did not keep up with the growth in housing costs. In 2019, Latinos earned a median hourly wage nearly $5 less than the wage of a median white worker. This disparity adds up to a widening wage gap workers need to overcome in order to afford a modest 1-bedroom apartment at fair market rent. As low-wage workers, Latinos are more likely to be working in jobs that offer few benefits, such as paid sick leave and health insurance, which would, at a minimum, help build a cushion of savings to weather an emergency. Next, there's also a shortage of affordable homes for very low-income renters, including Latinos. In 2018, only 3.3 million housing units, affordable for nearly 11 million renters earning extremely low incomes, were actually available for rent. Hispanic households accounted for 21% of extremely low-income renters that year. Lastly, I'll note that there have been policies that affirmatively discriminate or are perceived to be discriminatory by Latino and immigrant communities that have actually discouraged these communities from participating in assistance they need to keep their housing affordable. In recent years, the Trump administration's public charge and mixed status rules have forced low-income immigrant families to choose between family separation and keeping a roof over their heads. Let's turn to the effects of the COVID-19 pandemic and the crisis that has really amplified the value of a stable, affordable home. Evictions in a public pandemic are bad for public health. That's one reason why the CDC issued in September earlier this year a halt on evictions through December 31st of 2020. As US Census Pulse survey data shows, since the start of the pandemic, Latinos continue to fall behind on monthly rent payments. I'll note that while housing security declined, the unemployment rate for Latinos skyrocketed. In April, the unemployment rate for Latinos increased to 19%. This is higher for any other racial and ethnic group in the United States. Next, it's apparent that because of the jobs they have, Latinos as renters, as immigrant workers, and as low-wage workers in the service sector are on a path to even greater housing instability and a risk of eviction as this pandemic persists. According to recent analyses, including those of the Urban Institute, Hispanic renters are more likely to work in industries that have closed or laid off workers because of the pandemic, including restaurants, construction, entertainment, and other services. As this pandemic persists, Latinos continue to face high rates of job and income loss. And even when supports like expanded unemployment insurance are available, renters, especially Latino renters, are struggling to pay the rent. According to an UnidosUS poll of Latinos who lost work and income because of the pandemic, in July, more than half in states like Arizona, Florida, and Texas reported not having enough money to pay for food, rent, or utilities, even when they had access to these enhanced benefits. Lastly, federal relief efforts thus far have excluded large segments of the Latino community. For example, Latinos and mixed status families, some estimate 3.7 million children and 1.7 million citizen or green card holder spouses received no stimulus check. In addition, majorities of Latinos who have lost work because of the pandemic have not been able to access the unemployment benefits they need simply because they didn't know they were eligible or did not know how to apply. The good news is there is a path forward. The federal government can be making greater and more focused investments that would address the effects of the pandemic on renters and on the rental housing market. First, the federal government must provide immediate relief to renters and protect them against eviction. Congress already has at its table before them a comprehensive legislation that will provide emergency and short-term rental assistance. To this day, the House and Senate cannot agree to the size of a package, which has been thwarting any efforts to move this forward. We need a nationwide moratorium on evictions that allows renters protection at every stage of the eviction process. The federal government can also be essentially investing in local programs that provide tenants access to culturally competent eviction prevention, legal assistance, and tenant counseling. On the local level especially, it is important to note that landlords should be prohibited from asking tenants about immigration status, specifically because we know how much of a deterrent this is from families accessing benefits that they need. Federal government should also look at forward-looking investments that are needed to stabilize renters and ensure greater affordability and resiliency in the rental market. Congress should be creating a renter's tax credit to lower the cost burden for renter households. Proposals already have been put forward. The federal government should also be exploring projects around rent stabilization. should be expanding and improving the federal housing choice voucher program. Importantly, invest in the Housing Trust Fund, CDFI fund, and federal programs that direct support to community-based providers who are actually able to be able to plan at the community level neighborhood stabilization efforts. Finally, it's important that we move forward and strengthen the Fair Housing Act. We need to reinstate the 2015 Affirmatively Fair Housing Rule to ensure that communities in the planning process and development are ensuring that they remove barriers to affordable housing and ensure opportunities for greater economic investment. Thank you.
Agatha, thanks so very much. I really want to express my appreciation to Unidos for this brief. We need all this information now, and we need it concisely. And I love the charts to help us get out there and advocate for the Latino community across the country. I'm so pleased now to introduce John Martinez of Centro Campesino. When John called, I've known John for a while, and when he called and asked if I would participate, you know, it is hard for me to say no to anything with campesinos involved. My grandparents came from Guadalajara right after the Mexican Revolution and worked as children in the fields in California. I owe them everything. So always a pleasure. I want to say that among the things that Agatha spoke about, this idea that that mixed status families were affirmatively discriminated against and excluded from so much of the relief, you know, simply for loving an undocumented person, their spouse, their parent, their guardian, unacceptable. So I'm so glad that John is here to help clarify where this is going, particularly now because our homes, if we can hold on to them and be safe, have become so much more than that, right? They're now a schoolhouse or a preschool. They're an isolation ward for those that are ill. They're an office for those of us that are fortunate enough to work from home. They're a daycare center, and they're even the schoolyard in your living room. So important now to be safe and to have space, even when so many of us live in overcrowded conditions. I want to take now the opportunity to introduce to you a really fine advocate, John Martinez of Centro Campesino.
Good morning and good afternoon to all the attendees. I'm John Martinez, Executive Director of Centro Campesino. Centro Campesino was created in 1972 to deal with the deplorable living conditions of agricultural workers. Today, doing business as Centro Campesino, we are a community development corporation that strengthens families by providing affordable housing, home ownership solutions, economic advancement, and educational opportunities in Central and South Florida. Additionally, since Hurricane Andrew, Centro Campesino has developed extensive depth and experience providing disaster recovery services after a crisis, response, recovery, and rebuilding of damaged homes. For example, in 2019, last year, Centro Campesino repaired, weatherized over 115 homes, preserved another 100 homes, supported clients to access and close 150 mortgages on affordable housing, managed 132 affordable rental properties, and over 2,000 participants flow and graduated through our HUD-approved housing counseling program. Also, has a CDC, a community developer, Centro Campesino has built over 500 single-family homes and sold them in the affordable market in our history, including 10 amazing, beautiful homes in 2015. But as a small developer, we've not been able to build since then. The affordability price, the cost to build, and the appraisal numbers do not work for us or any nonprofit number, and the adequate support systems are not in place to support small developers and or moderate to low-income buyers. Centro Campesino today, in response to the financial impact of COVID-19, we're providing families in need in Miami-Dade and Monroe counties. Miami-Dade is the largest populous county in Florida. Also, Miami's located there. Monroe County are the Keys, for those of you from out of state. Emergency food, rental support, utility assistance, testing, outreach. our market and audience are low to moderate income families, populations that are most in need, agricultural workers, immigrants, undocumented, and other low to moderate income families. We also, Mercedes just reminded me and us that we've been operating as a educational pod where students, young students, elementary and middle school kids can attend our centers, 2 of them, and attend public school virtually so their parents can work. That is ending as of tomorrow. In Miami-Dade, all children must be back in school tomorrow, and those that can only go to school virtually, funding has been shut off for those centers that basically support that funding. That is for parents that can't pay the $250 that some are a day that some are charging. Anyway, so at this point, I'd like to provide a rationale for this conversation and the study that was created on affordable housing. But first, I need to thank Mercedes Marquez. I'll say something more about her in a moment, but I want to thank for this conversation, the Center for Disaster Philanthropy, NeighborWorks America, and UnidosUS, all dedicated to ensuring that families have a safe and affordable housing. I have to say that in the spring of 2016, Mercedes Marquez was the keynote speaker in Austin at the National MAFO Conference. After she spoke, I went up to talk to her and let her know that I was moving to South Florida to work on affordable housing. Her face turned red. She looked like she had a stomach ache, and I'm not sure if she was going to cry or laugh. She said, and I will quote, but not accurately, "You are freaking crazy. That is the worst market in the country to be working on affordable housing." Those words were so true, and thank you again, Mercedes. So let me provide a context. First of all, in the last 10 years, the state of Florida has virtually dismantled the affordable housing structure and support system. This has included raiding the Sadowski Housing Trust Fund that is intended to support affordable housing. Instead, the fund has been used for other state priorities, such as hurricanes, that's important, other demands, budget shortfalls, and to purchase furniture for the former governor's office. That is all accurate. It has an FYI, in the last 20 years, 1/3 of the fund, over $2.3 billion, has been diverted away from the fund and away from affordable housing. That's a big issue. Economic insecurity and the lack of affordable housing are not a new phenomenon in South Florida. High housing cost burdens, with 6 in 10 employing adults spending more than 40% of their income on housing or rent costs. 32% are severely cost burdened. Some people paying 70% of their income on housing costs. Excessive poverty rates in our area of 20 to 32% in our focus area. But the great news, high workforce participation rates. Over 80% of folks are actively working, but many, 40%, are actually patching together multiple jobs and gigs, 3 to 4 jobs at a time, per day, per week, to be able to make ends meet. And the conditions of farm workers and recent immigrants is still precarious, with low wages, lack of sick leave and health insurance, and without other basic protections. So with that framework, Hurricane Irma arrived in September 2017, making a tough situation even more difficult, destroying homes in the Keys, Monroe County, and damaging thousands of homes in Miami-Dade County, reducing the availability of housing options and expanding the gap in the need for affordable housing. As part and parcel of Centro Campesino's strategy, disaster recovery strategy, we partnered with several funders to be able to repair homes. This is an important fact, folks. I'm new to hurricanes 5 years in, but when a hurricane happens, the federal money to help folks to fix those hurricanes takes almost 2 years to arrive. So prior to that, it is individuals and nonprofits and foundations that are collecting money to fix homes and families themselves. So for within those first 2 years, we fixed over 86 homes, rebuilt homes. Now we're operating with the federal resource, which is wonderful but slow in repairing homes as well. We engaged with we also partnered with the Center for Disaster Philanthropy to support an ongoing conversation about affordable housing after a disaster. We engaged the Florida International University Center, specifically Dr. Edward Ned Murray and Dr. Maria Ilcheva and the whole FIU team. This conversation and process has included a series of community meetings with leaders and advocates that have skin in the game in affordable housing, a detailed needs assessment, and the recommendations that we're discussing today. Then, as we all know, COVID-19 arrives in March of this year. Today, COVID-19 is the disaster at hand that we're all dealing with. The COVID-19 pandemic and community economic impacts were not anticipated at the start of our study. However, the post-COVID-19 environment has required us to look and incorporate a new lens for assessing the pandemic's economic and community impacts in South Miami-Dade and Monroe counties. The pandemic has affected every aspect of our community, particularly harmful to those in the most vulnerable situations: minority populations, individuals living in poverty, farm workers, undocumented immigrants, elderly, and persons with disabilities. Additionally, farm workers and undocumented immigrants are at increased risk of coronavirus with forced work exposure. You want to eat, you work. You don't want to eat and you want to be safe, that's not typically a choice. Pre-existing conditions, no sick leave, health insurance, and not eligible to access the majority of COVID support. Lastly, in this conversation, we do not propose to have all the answers, folks, or even the right ones for your markets or your areas, or to solve all the critical issues of affordable housing. All we have is our experience, our analysis, and our observations, and we trust that you'll find this conversation useful. I will say, though, that going forward, any conversation on affordable housing or economic development has to include the COVID-19 pandemic front and center. It is here in front of us in whatever market you're in, and it has to be dealt with, and this is not going to go away soon. Thank you.
John, thank you so much. It really is sobering, isn't it? Stuff is so hard. So we're going to continue to chat today with a presentation by Dr. Ned Murray. They've done a great study of the Dade and Upper Keys markets. It's sad, but it's also just infuriating. And I want to say to you guys, as we come through and have this discussion today, we really do need to figure out how we're going to go forward and struggle and make sure that whatever solutions, whatever dollars, are, finally come through, that we get the share in the Latino community that reflects the need, right? Not more, not less, but that reflects the need that we have in all of the studies. So now I want to introduce to you Dr. Ned Murray to discuss this really important study that's been done. And later we'll talk about an article, I hope he'll mention it today, in today's newspapers in Miami, that really put real families on the cover and exemplify what it is he's talking about today. Dr. Ned Murray, thank you so much for all of your work and for being with us today.
Well, good morning, everybody. Good afternoon to others. Thank you, Mercedes. What a wonderful experience it has been over the last several weeks organizing this webinar, working with Mercedes and Agatha, so from UnidosUS, obviously, and John Martinez at Centro Campesino. I think just organizing this and sharing ideas and thoughts via Zoom meetings and emails, it's just been a great experience, and we'll be able to obviously continue that discussion with all of you in a few minutes. Let me also just say how grateful we are at the FIU Metropolitan Center to have been working with Centro Campesino and John Martinez, Bill Sevilla, and staff to be able to work with real professionals, nonprofit developers who've been on the ground for many years and really understand what's involved in affordable housing development, preservation, of course, the communities they serve. So with that, we began with a affordable housing needs assessment, as Mercedes mentioned, of South Miami-Dade, which is the coverage area for Centro Campesino, and the Upper Keys from essentially Key Largo down to Almirada. I'm going to just kind of give a quick overview of some of the key findings without getting in depth. Obviously, the study is available through Centro Campesino, and of course, we've completed the action plan, which I will get into a bit as well. And I know that's what we really want to get into later in our discussion, because this was all about solutions today, and we want to get to those as quickly as possible. Obviously, the needs in South Dade in particular, but also in sections of the Upper Keys, much of it having to do with past hurricanes, is quite severe. But looking at the demand side of the equation, which we always do initially when we do a housing needs assessment, we found that the area of South Miami-Dade is largely Latinx. It's an old established Latinx population, but it's been growing as well. But unfortunately, most of the people who live in South Dade who work are in low-wage service occupations, which obviously were the most vulnerable to the pandemic. And as John mentioned, when we started this was pre-COVID, so the situation was very bad then, and obviously it's gotten a lot worse since. So we began to look at those workers, those families in South Dade, in the Upper Keys, and obviously we looked at their occupations and their wages, and you can see those numbers there: 241,893 resident workers, mostly in low-wage service sector employment. These were the workers that have been and still are losing their jobs. The job shedding continues, and as John mentioned, things don't look like they're going to get much better for some time. We've estimated at this juncture that about 20% of those workers, and that may be low at this point, nearly 50,000 have lost their jobs already. And the unfortunate part of this, and based upon other studies that we've done, is that a lot of these jobs may never return. So that raises a whole other question as well, a whole other issue that we can discuss at some point further down the road relative to the future of work and what that means in terms of building a more inclusive and equitable economy. The renters, based upon the occupations and wages that we just talked about, obviously reflect the income. And you can see here that based on that, these renters, almost all of them, 90% certainly, who earn under 35,000, which is, a sizable share, obviously are cost burden. Next. So what we're looking at is a growing, severely cost burden group of renters. I think you all know what that means. That means they're paying in excess of 50% of their incomes, their scant incomes on housing costs, wondering when the next paycheck will come in to pay that next month's rent. And what we've established based upon COVID is that number has actually increased by about 25%. So another 4,000 renter households as a result of COVID-related job loss has taken renter households who were cost burdened under 50%, somewhere between 30 and 50, and raised them above 50. Now, the question then becomes, well, what happens to those who are already severely cost burdened? Well, obviously, those are the ones who are most vulnerable to homelessness and obviously extreme distress relative to some of the other issues in terms of food insecurity and medicine and other things. We did a gap analysis of the units, the supplies that are already in place. Now you have to remember that South Dade, in particular, the rents and owner costs are much less, relatively less than the rest of Miami-Dade. So when you're seeing a gap of nearly 15,000 units for renters in the extremely low to moderate, we're looking at rents that are fairly low, relatively speaking, to the rest of Miami-Dade. So obviously this reflects those wages, those occupations that I just mentioned. And in conclusion on the assessment, probably the most important thing that we had to keep in mind as we moved into the actual policy recommendations and program recommendations was the understanding that this is only going to get worse. This is going to continue not only from a housing standpoint, because of the lack of production and the inability to preserve a lot of these units, but also the market is obviously continued to drive a lot of these costs. A lot of that is an external market. Miami-Dade and South Florida in general, a lot of that market is external, that's driving up costs. And then that imbalance is only going to grow. And now that we have COVID, is obviously that's going to get much worse. Some quick economic data. These are your primary municipalities in South Dade. This is where most of your workers live. Homestead, Florida City, Naranja. You can see them listed there. You can see the incomes. All of those median household incomes are below the county average. And if you look to the table on the right, you can see really, really high, obviously, poverty rates. And the thing to keep in mind here is those poverty rates reflect working poor. These folks have jobs, many of them 2 and 3 jobs, and look at the poverty rates even with those jobs. So this is your working population. Quickly, once again, we then looked at what's very important is knowing where the workers live and then where they commute to each day. And you can see by these numbers here, particularly on the South Miami-Dade side, we have a big net loss, or should I say a negative in terms of net commuters, which means that a lot of the people here, even though they're making $12, $13, $14 an hour, they're still having to commute to their jobs in these low-wage jobs. So you can think about what that means relative to housing and transportation costs. So you can see it right down the list there, other than maybe retail salespersons. Most of them are commuting each day and having to earn wages that can hardly support rents and mortgages. Next. We did quite a bit of mapping on this project that's available in the study as well. On the left, you see cost burden owners. On the right, you see cost burden renters, and you can see those darker colors there. What that means is if it's in red, that means 51 to 100% of the renters are cost burden. And we already talked about 90% of those earning under $35,000 were cost burden. You can see from that map, particularly on the renter side, that if you live in South Dade, you probably are cost burden, particularly if you are a renter and a worker household. Next. Mercedes had mentioned the article today in the front page of the Miami Herald. Great job reporting on that to the Herald. Give them a lot of credit. We have zeroed in on our study area here to look at the properties that are most vulnerable. These would be considered unsafe if, say, a Irma, or God forbid, an Andrew, whatever to come, and it's just a matter of time, of course, and we're still not out of the hurricane season. But you can see those yellows there, those are single family homes, the red are multifamily, and we have condos and townhouses. You can just see the numbers, the high concentrations of properties that were built prior to 1990 and are not up to code. All these properties would be highly vulnerable to a major hurricane. So we have such a big issue here because it's not just about affordable housing, it's about safe, decent, and affordable housing, and the safety and well-being of the residents has to be a big part of our solutions. So what have we come forward with? Well, all these strategies deal with the post-COVID world. Number one is we have to focus on the immediate affordable housing and community development impacts of COVID, and 2 of the programs, and we can talk a little bit, I'm going to go through these and just to highlight them. Obviously, there's a lot more detail in the plan, but we have to target our renter assistance. Now that we know almost on a block basis or a property level basis and a population level basis who are most distressed, we can do better targeting of our renter assistance, and that's going to require some outreach as well to be able to, particularly as John had mentioned, you have undocumented workers, you have immigrants, you have people who may not, be able to speak English. So you're going to have to do this in a targeted way with a lot of outreach. And then an enhanced community stabilization program, which we can get into a little bit more later. But this goes beyond just housing. It gets into a lot of other types of levels of assistance based upon the larger community impacts of the COVID pandemic. Next. Strategy number 2 addresses that very issue that I just brought up, is to increase the supply of safe, decent, and affordable housing. So much of the housing that is affordable in relative terms in South Dade and certainly in South Florida for that matter is not safe. So you can't even call it naturally occurring affordable housing because we don't really have a whole lot of that in South Florida. If it's affordable, it's probably not safe and decent. And we just need to call it what it is. So we have a safe housing assistance program that's going to be able to address that. It's addressed in the policy brief, which I think is attached to this webinar. And then, you know, once more and more ramped up home buyer rehab assistance program so that we can get elevate the opportunities for purchase rehab as we go forward as well. Next. Strategy 3 gets into the actual production, and that's the tough one, as we all know. It's costly, land, construction, the price points, all that type of thing. But number 1 is we have to have a very aggressive property acquisition program and an affordable housing pre-development support program connected together, particularly for organizations like John's, for nonprofit developers. They're the ones who are going to have to carry the brunt of this. Obviously, we have LIHTC projects. We have a lot of other things that we can rely on. Well, let me take that back. We don't have a lot of other programs to rely on other than maybe LIHTC, but we're going to have to be much more aggressive in terms of acquiring land and even properties and basically doing land banking of those properties and then providing the pre-development support for organizations like John's and others to be able to actually cover those costs as well. Strategy 4 talks about the community economic development piece of it. One thing we've been talking about in our meetings with Mercedes and Agatha and John over the last several weeks is you know, just how important it is to connect all the dots in this post-COVID economy where housing and job loss and health and all the other associated issues that have brought distress into the community have to be looked at in a more holistic and integrated way. So there's no such thing as just a housing study anymore. There's no such thing as just an economic study. Everything has to be joined together to make sure that it is community economic development, not just economic development, but actually community economic development, so we know specifically who the beneficiaries are going to be of whatever economic development occurs. So obviously small business development, much more enhanced, much more targeted, much more focused, as I mentioned earlier, with relative to other programs. And then a whole host of different things that can be done in the affordable housing front in terms of construction, new technologies, to be able to you know, skill the workers and get them into jobs that actually pay better wages. And construction is a really big industry. It always has been in South Florida. Let's ramp it up once again and target it and make sure that we have these types of programs in place to benefit the workers who live in South Dade. And then this, well, strategy 5, which is the next to the last, we're going to have to do something much different here. We have to expand funding sources and the type of community-based partnerships that we have never seen before. So obviously there has to be this partnership that's put in place, first of all, which is going to look a little bit different than the past. You know, we've had a lot of private-public, public-private partnerships in the past. This is going to have to be modeled in a post-COVID type of framework, and that's going to be key. And the program initiative that comes out of that is going to have to be one of the first program initiatives from the partnership would have to be the creation of a South Miami-Dade Community Investment Fund, and we can talk about how that gets capitalized and seeded. And then lastly, we don't have anything real specific relative to this in terms of program activity, but this is something that Centro Campesino and talking with Mercedes and Agatha, you know, we all agreed that we really need to do much more aggressive affordable housing advocacy and community education relative to the issues we're dealing with post-COVID, and that also includes fair housing, which hasn't gotten a lot of attention in recent years. in Washington, but certainly something that we have to really focus on as we have in the past, because fair housing is still a major issue in South Florida, and we need to carry on that conversation. So with that, those are some of the key findings, obviously the outline of the recommendations, and I really want to be able to leave enough time, because we have such great people on the panel, to be able to share some of their thoughts. Thank you very much.
Thank you so much, Dr. Ned. Well, you can all see kind of the depth of review here. And I so much appreciate the integration, the cross-sector analysis on labor and housing markets, because without it, just very, very difficult to understand and know where to begin. I invite you all to start adding more questions to the Q&A so that we can get to it. I'd say there's so many things here to talk about, right? Dr. Ned, we've talked about so many strategies, and I imagine that we're going to make this study available. I guess it's on the Centro Campesino website. So we'll talk about it. But of all of these strategies, where do you think is the place to begin?
Well, it's a great question, Mercedes, and one that we've been wrestling with on a number of fronts. We did a webinar yesterday on when work disappears, and that's available on our website as well. I think there has to be short and long. We have to do it concurrent. We have to walk and chew gum at the same time here, that there's the emergency response that has to take place, and that gets into the direct renter assistance. We need to get funds. We need to find these individuals and be able to assist them on the short term. But that's not to say we can't begin at putting these other strategies and programs in place as well. And the one that I think would be most critical there, Mercedes, is let's get this partnership in place pronto, and lay out the charge that they have to create this investment fund. Because once we can capitalize this, seed it and then capitalize it, then that pre-development assistance, some of the other assistance that we mentioned, and these other strategies can begin to really play out. We can't wait. Hopefully things will change in the coming year in Washington, but we can't wait. So we need to be able to create that local investment fund as soon as we can.
I appreciate that. John, today in the newspaper, it's mentioned that there will be some kind of donation of government lots for affordable housing. What's your take on that?
Well, it's a great news bite and a great article, but let me tell you exactly what it is. So for a transfer of $10, $10 million worth of individual lots are going to a very large private developer to build homes. The homes must sell for $205. I will tell you that the county has had similar where they would give one or two lots away with the condition, if it's a single family home, must sell at $205. If it's a duplex, must sell for $160. Those prices are not realistic in a market. For instance, in Homestead, which is a farm worker and bedroom community, which is considered more affordable than Miami, market rate homes are $300 to $350 that are being built right now. That is not affordable and not realistic, but $205 is not either. So it's a great article, great news bite. Again, those are not prices that one can build.
I appreciate that. You know, we've been talking a lot in the last few weeks, as you all have noted, about where to begin, how to start. And John, you're right. So many years ago, when you said to me that you wanted to move to South Florida, I had just come, just coincidentally, from meetings in Florida, where it was clear that the state government was dismantling so much of the infrastructure and the funding for housing. And so when you shared with me that you're going to move, I was, worried for you and for Centro Campesino about, what was going to be possible, and what you've laid out about there not being enough subsidy and kind of the market understanding not being refreshed to match the price to the subsidy has kind of, borne that out. So much so that, from my clear point of view, in Florida, there's no question that this issue of the funding is a civil rights issue, and why the affirmatively furthering for housing standards need to be strengthened, so that we understand that there are lots of ways to violate people's rights, and not funding and making sure that you can't afford to buy a house to rehab it, could be among them. There are questions about why not take steps to make affordable housing development more attractive to developers. We can increasing density, tax incentives, allowing micro units, and new construction techniques maybe could go a long way. What do you all think about that? Given this market, how would those types of changes matter? I am particularly sensitive to the issue of capacity and how difficult it is in the Florida state finance system for nonprofits to compete. John or Ned, would you like to comment?
Well,
Ned,
yeah, well, I could start, Mercedes, and then let John take it from there. I agree with you 100%, Mercedes. Those of us who have worked in other parts of the country, especially you and John and Agatha, and I certainly know this, that we have, many parts of the country have very strong nonprofit CDCs, nonprofit developers, mostly CDCs. And even in those parts of the country where they are well supported and by local and state governments, it's difficult to compete in the private market, particularly when there's a lot of appreciation going on in the market, like South Dade or Miami-Dade and South Florida in general. That's why the whole issue of creating a fund, an investment fund that's specific to the needs of an area like South Dade, and that's what we would call it, a South Miami-Dade Affordable Housing Trust Fund, whatever we would call it, and to seed and capitalize, but then put the programs in place that are geared more towards nonprofit developers. Certainly we want private developers involved. We can have partnerships, as you all know, between nonprofits and private developers. Those can work really great. But we have to kind of rethink the way it's all being done right now, because right now, if it's not a LIHTC project, nothing's getting built. And we need to begin to think a lot more creatively, but it all starts with money. It all starts with capital.
So
thank you. John,
let me respond in the following way. First of all, I want to say this, that there's some basic solutions that would not cost any money, and there's others that would require serious priority and investment by policymakers and funders. But let's talk about the cost of affordable housing and development. I'll give you an example. A local policy change. I'm trying to frame these recommendations on how they work in our market, but to also make the detail on how they might be relevant to other markets as well. So let's look at local policy changes. For instance, there is a mortgage ready program in Miami-Dade County that has, there's several that have down payment assistance programs to choose from. There is one which could be amazing, but it can lend up to $80,000 to qualified buyers. Yep, that kind of subsidy is important in this market. Unfortunately, it has a purchase price cap ceiling of $205,000. That's dating back to 2006, 2008. That cap is outdated. Finding a decent, safe home selling at 205 is not a possibility in 2020. You might be able to find a townhome in an area where one may not necessarily want to live, but to have a safe, affordable home at 205, that is not an option. Because of that sales cap, that county program only closes on about 100 loans a year. That program returns money to the county coffers. Let me tell you, qualified home buyers can take advantage on what could be a stellar program for all. Raising that cap to a more realistic level, an affordable market level, would benefit qualified home buyers and nonprofit developers and make that county program a true success. That policy change could in fact mean closing on potentially 300 more mortgages a year on affordable housing. The county administrating staff, the program agree, local lenders, banks, nonprofit developers all agree on the change. but the political will has not existed at the county commission level in this election year. But there could be an appetite for change after the election. I would urge all Zoom participants to seek and research for any existing program abnormalities that they could work on to get changed. So what the individual asked the question, why not involve for-profit developers? They're involved, but based on the cost to build, cannot break even or make money building affordable housing, particularly when one is mandated to sell it at 205. I will say, this is documented, the county did a test this last year. They built 2 homes and sold them at 205 and had a celebration. So wonderful celebration. They paid $300,000 for each home to build, but they sold them at 205. That type of math and numbers doesn't work for a for-profit developer, doesn't work for nonprofit developers either.
Well, there it is.
So, may I add? In terms of the solution, again, I believe that community development corporations like Centro Campesino and other nonprofits are the answer, but meaningful participation of the nonprofit development community is important. What would that look like? There used to be a funding set aside. There's still a small one, but create a funding set aside so community-based organizations can be able to build their capacity to build affordable housing and to be able to build and scale. In Miami-Dade County, there's a small group of community development corporations, but most of us, we lack the capacity and resources to compete with large for-profit developers who, for the most part, they're not going to build in the affordable market. There is the hottest market right now are homes over 400,000. That's what's hot. CDC's in Florida. There are 12 Neighbor Works America organizations that are phenomenal high impact organizations that have a combined investment impact of 150 million. Yes, Centro Campesino is one of them, but there's a total of 12 across the state. In the United States, there's over 250 stellar Neighbor Works organizations with a combined $9.6 billion impact that can build and have capacity. CBOs, community development corporations, are part of the answer.
Say, Mercedes, could I add to that just one point?
Sure.
A couple years ago, the Metropolitan Center did a affordable housing linkage fee study for Broward County, where as part of the study, as you know, you have to actually determine the gap per unit of production to figure out, the linkage fee. To meet the price points that John is getting to in terms of low and moderate income owners or renters, we were looking at, once you look at land costs, construction costs, soft costs, we were looking at between 150 to 180,000 per unit to meet those price points. So that's the kind of gap that we're dealing with here, and why it's so difficult for anyone, to build affordable housing.
Wow. If we could, I'd like to ask Agatha, lots of questions, lots of themes in the chat, the Q&A. Just let's start seeing if we can't focus this a little bit on the issues of solutions, of great examples in other places. I've had the pleasure of working with Agatha now for several months at Unidos as they try to focus on this exact thing, on solutions and working with affiliates. Agatha, could you comment a little bit about the work in California? And if I can help you fill in, I'm happy to do that.
Yes, thank you, Mercedes. So UnidosUS has been working with a smaller group of our affiliates who are nonprofit organizations, affordable housing developers, managers of single family and multifamily properties, as well as housing counseling agencies, so kind of across the spectrum. And what we're learning is that each organization has its own level of capacity and understanding of how to use federal dollars and understand how to utilize the programs that come out of the state's federal budget. So I will say that in Florida, you are all not alone. State by state, community-based organizations, especially nonprofit developers, are facing very similar challenges. If I may, I do want to add that in California, just last week, There was a new bill that was passed and I believe signed by the governor. It's SB 1079, which actually gives current tenants, community land trusts, housing nonprofits, public agencies, and prospective owner occupants the right to purchase foreclosed homes. So these are single family properties if they can match or exceed any high bid submitted by investors at the foreclosure auction. That actually squarely points to the concerns that John and Dr. Ned Murray also mentioned, is that we need to build the capacity of nonprofit agencies, because there are policy, even if we make the policy changes like in California to be able to claim those properties and refurbish them, we still have to develop the capacity to outbid. And I think Mercedes can attest to this. Many of our affiliates have also led the way through neighborhood stabilization efforts that were piloted by HUD's Neighborhood Stabilization Program. There is, again, I think, as I was hoping to provide in the presentation, is that there are various efforts and existing opportunities. So there are many tested, tried and true programs that HUD and the federal government and local partners have tested and showed that, demonstrated. But we need a lot of those programs back, like the Neighborhood Stabilization 2 program, which allowed nonprofit economic development agencies, CDCs, to compete at the same level as for-profit developers. And there was a federal government was helping with the capital. And providing extensive TA. So I think it's worth noting that we do have solutions. We have tried and true, proven programs. What we need is more political will to help them happen. So, based on what we're doing in California, turning back to that, we are working on, looking at doing some research. We're working with a consultant to essentially look at how affordable housing programs in California have been impacting Latino housing outcomes. So this is not just looking at Latino communities in major urban areas, San Francisco, Los Angeles. We're also looking at the smaller communities and trying to better understand what particular programs are effective, which ones, and if they are effective, how we can increase their budgets and make sure that when the programs are executed, they are designed to actually reach the communities that need it the most. The farm workers, our folks in rural communities, the really small communities that are often underserved by federal government, federal funds. So, that is to say, we have a lot of models out there. We work very closely. We know of another affiliate in San Francisco, Meta. They have been working very closely with public and private partners, especially foundations, to buy properties, refurbish them, and keep them affordable as a strategy to prevent displacement and preserve communities. So I think there are quite a few examples out there. I think the COVID-19 pandemic's impact on getting to these solutions feels overwhelming. But I think it's worth noting for this audience and for everyone out there that there are solutions. And I think we also need the political will, including the ability to come together at the table and make these changes possible.
Thank you, Agatha. I'd like to get to some of these questions, and if I could, I'll try to get to a couple of the answers. This idea of, how do we get there quickly? How do we stabilize these markets? Dr. Ned spoke about so much of the housing that exists that's in the path that is pre-1990 in the market that is really not up to code. Certainly, basic programs from the federal government that cities and counties and states receive can be used as rehab programs to bring things up to code, right? And so it is always, depending on the property, but almost always it is cheaper to rehab than it is to build new. So as a stabilization technique, important to focus in. We now have the map of where they are. We know locally in South Dade, something you all can look at too in your markets, where to target. and work with the government. Of course, there has to be government will to go in and help do those basic rehab items. Many cities across the country have these small rehab programs. Sometimes it's not, massive amounts of work that it needs, and that you do it. And oftentimes these programs are focused on the elderly. I know Los Angeles has what's called the Handy Worker program. It's been, oh my God, at least 15 years, incredibly popular program with seniors, brings their stuff up to code, gives them ramps, things in the showers, helps them keep in, and keeps that house viable in the market. So there are lots of programs like that you can look at. Also in San Francisco and other places, there are these small sites programs that Agatha's talking about with the city funds, and you go in and do small acquisition. And I like that because it does a couple of things. It maintains the integrity of the neighborhoods, and it brings the rehab at the level of smaller nonprofits so that you don't have to go big. It allows them to be able to afford that and stabilize, small multifamily units. That's important. Someone in the chat spoke about, what about rent to own? And certainly that's where the power of community land trusts is really powerful. There, the issue again goes back to what we've been talking about. You need the funding to be able to acquire in the first place, right? To build or to rehab. Those could be sites, those don't have to be all in one place. That could also be a small sites type of thing that you can acquire slowly and build and have families be able to do that. In Los Angeles, I ran certainly a homeowner program, a down payment assistance program. Not only did we scale it so that we went from very low income up to moderate income, because in Los Angeles housing is so expensive. We were able to use different funds, federal funds for one, other income funds that I had from other mortgages that we'd gotten back to use for moderate income buyers. We could do that. But another idea that I would put forward that worked very well in Los Angeles is that we started working directly with for-profit developers and giving them a forward commitment letter that they could take to the banks, and they agreed as a result at a price point to do a set aside for low and moderate income buyers. We set aside mortgage, assistance to be able to do that, and it was a way to integrate the financial power of for-profit developers and the subsidy that the government could bring to make it possible for low and moderate income families to do that. So I'd say that's one way that was a win-win, because if you work with for-profit developers upfront while they're working on financing, that is the place that you impact their pro formas, and a lot of success in that. And we were also then able to select units that, like from a fair housing point of view, were spread across the different parts of a building, so we weren't segregating anyone by income, and also we're able to select the developments on rail so that we put them on transportation. And so we're able to take advantage of a lot of these social investments that were being made to make sure that everyone had a chance to be on, one of the lines, the gold line, let's say, in Los Angeles, and be able to have, an opportunity to lower all their other costs. So those are among the things that we can do. I want to check in the chat and get some other things. There's a question for you, John, about how the eviction moratoria is impacting affordable housing developers in your market.
So in the Miami-Dade market, and I'm sure in other parts of the country also, small nonprofit developers and those of us that have rental portfolios, of course, we're being impacted. We estimated in April that the first 3 or 4 months would be light with issues, but then August going forward was going to be pretty severe. We have seen that steady incline of people not being able to pay rent. I responded to that individual directly on that point on the chat, but let me mention this, is that on our properties, many tenants have not been able to pay rent on the 1st. And these are working folks, but by the 30th, they pay the full rent. And we're not charging, aside from the obligations we have not to, but we're not charging any late fees, and we're not evicting anyone. But people are struggling, and some people are not working, but a lot of people are working and they're struggling.
Thank you, John. I can add that some of the data that's coming out about how affordable housing developers are faring, a lot of it depends, of course, their market and on the mission of the housing, right? So folks in the first months, March, April, were paying all of the rent and paying it on time. As time has gone by, and as Dr. Neb made clear, some of these folks that are now unemployed more permanently. So it's becoming more difficult. But also, the deeper the subsidy was, so for instance, very, very low income people, they were hit sooner. So they're having a much more difficult time now paying that rent. Also depends on who is the population. As we talked about, a lot of immigrants, these mixed status families, are not entitled to the extra amount. So they haven't been able, right, to make their full rent. Many people, when they've received these $1,200 payments or the extra $600 on unemployment insurance, of course they've applied it to rent, because as I mentioned earlier, your house is now the schoolhouse and your office and the gym and everything else you have to be able to stay in. So it's really kind of dependent on those types of factors where you are. But there's no question that it's getting more difficult now that the extra unemployment insurance has ended. People are struggling more and more to pay. They might pay some, but as time goes by and still no relief, it is becoming more difficult. Agatha, I don't know if you have any other data about how that's going in the market, people being able to pay their rent in affordable housing.
So let me make one more comment. So prior to COVID, prior to the hurricane, we had 100 people in line. Yes, 100 people signed up for every unit that we have of affordable housing, waiting either for someone to move out or to pass away. I kid you not. Now it's closer to 300 people that are signed up. So they're not only are some people not able to pay rent, people are looking desperately for a clean, affordable place to rent. Invariably, on a monthly basis, I get an email or a phone call or a letter of a private developer from all over the country. I was going to say back east, wanting to buy our properties and pay cash. But we know that these developers, they're looking for expiring tax credit projects and others to be able to buy. We know the moment we were to sell, they would be market rate units, and the individuals in our community would not be able to afford those units.
Wow.
So your mission is important. Not only are you able to rent to folks, but what is your mission? And also our bottom line, how long can a nonprofit developer sustain individuals not being able to pay rent? Again, small nonprofit CDCs like ours, we work very hard to ensure that people have a safe place and that people are working and be able to be able to pay their rent as well. We work with them. But even though there's moratoriums, folks, there are people being evicted in our market and in other markets as we speak.
Agatha, can you add anything to the discussion about what's going on with the ability to pay rent?
So where shall I begin? I think, so I just wanted to note that we included in this, in our issue brief, and I did share a link with folks through the Q&A, how to access it. We did include a story from, actually, that came from Centro Campesino and John's organization, of a family that was just painted a very clear picture of what's happening for families across the country, and the real inability, the real structural barriers that are been put in place to prevent families from seeking and actually accessing the benefits they need. We've heard from families, actually from our affiliates in New York City, as you know, one of the hotspots for coronavirus. And I think it was in January, I think it was around March, we did hear from our affiliates that, our affiliates specifically in Queens, in the Corona neighborhood, that many families, especially in multifamily properties, in apartment buildings, where it was just, you couldn't physically distance from each other, that people were dying. There was one woman I spoke with who was a tenant in New York City, in Queens, and she, in her building, 15 people had died from COVID-19, including the superintendent of the building. And it's just, I think it's understanding that when you have difficulty paying rent, it isn't just that you don't have the rent, that there is money that is going to other things that you need to take care of, like your family. You need to take care of paying the utilities, paying for your car, paying for the gas that you need to get to work, unless you happen to be, by a good public transportation system. But it's the erosion of families' ability to pay rent is really stark, and this is not something that we're going to be seeing, next year. We're seeing it right now. New York City, we know in California, we've been hearing about families who are from our affiliates who are standing in food lines because it's not just about the cost of rent. It's about how expensive food bills are right now. In our brief, we also mentioned how almost one in 3 Latino children live in a household where they couldn't pay rent in the last few months and didn't have enough food to eat because families are facing this horrible decision. And John mentioned this, do I eat or do I pay the rent? And it is unconscionable to think that many families have had to deal with this. I will say that similarly to what John is experiencing in Miami-Dade, we've also heard an affiliate in the same affiliate in Queens, New York. As soon as the New York State's rental assistance, COVID-19 rent assistance program opened, this particular affiliate received 400 calls for assistance and was only able to help 200 people. And the funding ran out in a matter of days because there just wasn't enough to reach the needs. That the state didn't have enough in its coffers to really understand the demand. But I think I make that point to underline the fact that community-based organizations and nonprofits are really holding up families in need right now. So it is really imperative that at the state and federal levels that funds need to support these community-based nonprofits, these local providers who are holding up half the sky to ensure that families stay in home, stay in place, and essentially don't become evicted, don't lose their homes in a public health pandemic. It's simply cannot happen.
Thank you. I mean, real heroes. There are questions about all kinds of things. I'm going to try to get some of them. A question about the fact that in so many urban areas, folks are moving and what's happening to price levels, both commercial and residential in these areas. New York, San Francisco are really talked about. I'd say to you, I've been talking to some economists and we don't really know. I mean, it's too early to tell. Some places, in Los Angeles, home prices aren't dropping, they're going up. And as John said, there's money in the market. And so homes in South Florida at $400,000 or more, that's where it's at. An economist I spoke to in California told me the same thing. He felt this was a national thing, that the middle class who was able to work at home, who was not unemployed, who has saved costs in lots of other ways, has actually money to spend. And that is why home prices are not dropping. And now that interest rates are so low, that we're going to see a lot of movement in the middle and upper middle class markets. So we'll see. It's possible, I think, that in commercial corridors, there will be a need to take a look at how commercial buildings are rethought, what needs they now meet, and how do you afford to do that, particularly the issues of ventilation. So, things like that are happening. Also, there's a question about that some of the largest owners of vacant lots and teardowns in underserved areas are churches, and what about any partnership with them? I'm going to ask the panel to talk about it, but I want to tell you that my experience when I was the housing director in Los Angeles twice was that churches have their own needs, and so they have to decide if that lot, if their mission is speaking to them in terms of providing affordable housing, which means it's a non-economic investment for them. It's a mission-driven investment, or whether the church itself, given its own finances, needs to make money on the sale of that lot. And so it depends a lot on where they're at. And oftentimes in working with church leaders, it was clear that they did not understand that if they built that affordable housing, that they would get part of a fee for working with someone, but that it's a mission investment not a long-term money-making investment. So that's often an issue. I don't know if any of the panelists have experience in working with churches.
I could actually add to this if possible. So previously before I joined UnidosUS, I worked for a local CDC in Baltimore, Maryland, and we actually did try to entice a church, a Catholic church, in a largely immigrant neighborhood to consider renovating its property and donating some of its property for affordable housing development rehab, so repurposing. They had the infrastructure. It was a really, you know, in the developer's mind and the CDC's mind, you know, this was a pretty easy rehab. You had a dorm style living, you know, it was already available. The church had essentially had vacated because unfortunately because of the revenues and membership at the church, a lot of membership had gone down. So there was a property that was quite valuable and could have been quite, you know, it could have been offered, you know, for residents in the local neighborhood, and the church had just essentially let this property go vacant, hadn't been able to occupy with any particular parishioners or any of its own, you know, membership. So when the CDC came to the church, it was like having a conversation with someone who had no idea what you were talking about. It was really important in that conversation for the CDC to lay out the costs and benefits. And to Mercedes' point, it's important to understand the mission of that church and where that church, what that church's relationship is with the neighborhood. Like, is it worth the investment to be able to open up their doors, so to speak, in a property for an investment, you know, and even if it is a local house, you know, I would say a nonprofit community development corporation that has strong ties to a neighborhood where the church is, probably will have a better relationship, a better in with that church versus a for-profit developer that's coming from, you know, who knows where. So those relationships are important. Tying it again to the church's mission, understanding that their membership is coming from that neighborhood and that community, and understanding the needs. So actually stating the needs within that community and how that church's mission and AKA their property fits into help making their neighborhood grow and be healthier for the community, I think was really helpful in getting that transaction moving forward.
So let me respond also from a kind of direct and focused community perspective. Centro Campesino has community and church leaders on our board. Let me tell you this, churches, particularly small congregations, small churches, they're having a desperate time, just like all small businesses are, with their revenues declining. And they still have expenses, just like a small business that never closes. They're open, they have continued expenses, but their revenues have declined. And so I would agree with Agatha and Mercedes that having access to land is wonderful, has an asset, but how to deploy that is basically depends on your mission and priority at this point in time as well. They're struggling. I would like to say this. I'm going to repeat this though, that in any environment, particularly COVID-19 right now, with declining revenues for all, even tax revenues, creating housing options and increasing revenue for that expenses, would need housing. Creating housing options would need to be a economic development priority as part of a strategy by policy and elected leaders. Without that focus, the current situation will continue.
I think you're on mute, Mercedes.
Thank you. We are almost at time. I want to get to a couple of these questions with the few minutes we have left. Some folks asking for information related to federal, state, and city plans aimed at developers in the low-income segment. Where can they get information? Certainly on the Unidos website is where I would go. I would also go to Enterprise Community Partners, a national website. I would go to NALCAB, National Association of of Latino Community-Based Assets, NALCAB. I would go look at all three to give you a good sense of things that are going on. There are also different state and local big kind of agencies that look at not government, but overall, I'd look at Housing California, for instance, go on their website. They could certainly help you. And there are organizations like that across. I looked at HUD, you could go at HUD's website too. Amazing, there's still things hidden in there that you could find. Go to the neighborhood stabilization program on the web, and that will take you to the HUD user site where there are best practices and videos and all kinds of things like that. Someone is asking about if someone could speak to the differences in the infrastructure and funding and COVID impacts that we're seeing between urban and rural communities. Can anybody speak to the difference? Ned, maybe can you speak to the differences on what's going on in urban rural?
Only with respect to South Dade, obviously, because a good chunk of John's market is rural. A lot of the ag area of Miami-Dade, and we do know as you get forward into the Southwest and the Immokalee area, you have a lot of ag and ag workers, and including a lot of undocumented workers. Not a lot of direct assistance there. They've really been left out. I think John may have mentioned that earlier on. A lot of course, if you're undocumented, you don't even qualify for these programs. But it's really, as I said earlier, that there's such limited resources, and I think you had used the term earlier, Mercedes, regarding deep subsidies. That's really what is needed here. You know, we were talking earlier, and in fact, Agatha had mentioned NSP too. You know, we really are going to have to look at, and it's not going to happen obviously in the next few months, but down the road, to really address the scope and scale of what we've been talking about today. We're going to have to revisit some of the deep subsidy programs that work very effectively through HUD, as you know, Mercedes, during the 70s and 80s. And it was before your time, but we used to build housing. We used to have Section 8 new construction. There was the talk about the churches. Section 202 was a big program for churches who wanted to be able to, you know, bring their elderly parishioners nearby. But it's really gonna have to take, whether it be at the urban or rural level, we're looking at deep subsidies again, at least to get us through the next few years, just like we're doing right now with on the CARES Act relative to the economy. We're going to have to see something very similar in terms of housing production and preservation, where we're going to have to go back to these deep subsidy models that worked incredibly well during the 70s and 80s. And of course, they all went away. So I guess that's my 2 cents on that. It's just very frustrating dealing with this right now and over the last few years, knowing the demand, the unmet demand, and the distress that's out there, and understanding that there's just limited resources. Even with the resources that are available, they can only go so far.
Thank you. You know, we are just at about time. For those interested in rural housing, though, I would go on the web, look at the USDA website. You'll find things hidden there too. Look up Rural List. There's some others. Agatha, can you give me a quick?
Sure, I was about to say another thing to add to the list is the Housing Assistance Council website will have a lot of information about the impacts of COVID-19, both on the infrastructure and on rural communities.
Exactly. So look up HAC, their Housing Assistance Council. They're great, actually. Been around for a long time. MAFO, I would look at MAFO too for farm worker housing. I think that would be great. I want to thank everyone for joining us. This has been an amazing hour and a half. I can feel the love and the commitment and the perseverance across the internet. I want to remind us that we're emailing everyone a copy of today's recording and the slides so that you can take a look at the whole thing. and keep your own work going. We wish you all safety, health, that your families are thriving, and that we will get through this as we always do. Que decimos los latinos, nos ganamos la vida, and we will continue to strive for excellence and safety in our communities. Muchísimas gracias. Thank you so much for your attention and your commitment. To FIU and the production staff, man, you guys have been great. Thank you so much for your work. Thank you to Centro Campesino for starting the whole thing. I'm very grateful to John and all the folks on your team. And Unidos, thank you so much for the great work, the great partnership, and all of this beautiful information that's going to help us all advocate for justice in our communities. Thank you all so much. Buenas tardes. Bye-bye.